Good morning, pharmacology. I just wanted to say hey. My name is Sister Lucero. Most of my students call me Cecily by my first name. Um, I am sad that I can't be in class with you today, but you get to be with Sister Tootie West, and she's pretty amazing if you ask my opinion. If you haven't had me before, then I'm excited to get to know you. If you have had me before, I am way excited to get to hang out with you. So this is my first video, so it might be choppy, but I can't be in class today because I'm going to be working. I'm training at a new job. But let me tell you a little bit about myself. So 10 years ago, I decided I wanted to be in healthcare, and it couldn't have been a better decision. So in 2005, I started as a CNA. I started as a tech on North 6, which is a surgical unit, and I did that for a year, and then I decided to enter the float pool, which was super cool. I was trained in 3 different facilities, 4 different facilities in the UCR float pool, so 31 different floors. So they'd call me in the morning, and I would go to whatever floor they wanted to. This included ICUs and transplant floors, trauma floors, everything, and it was so fun, and I got to know a lot of really cool people. Being a CNA was a really amazing job. And then I started nursing school at Westminster. I was an LPN for a year on the children's surgical unit over at Primary Children's Hospital, and then I did the past 6 years in the pediatric intensive care unit, where my specialty was respiratory. So if I had to pick my favorite place, it would have to be the PICU. I really enjoy working with little kids, and I really enjoy working with the doctors that I worked with and with the different types of illnesses that I saw. And I'll be sharing a lot of my stories in class to help you understand drugs a little bit better. I was recently hired onto CPRU, which is the Cardiac Procedures and Recovery Unit over at IMC, and I'm excited for my new adventure. And that's where I'm going to be today. That's why I'm not in class, I'm being trained. So let's talk about the syllabus a little bit. So the syllabus is on Brain Honey right now. And what I really want to stress to you is I want you to print out a copy if Tootie hasn't already given you a copy. And I want you to highlight all the important dates, because Brain Honey, as of right now, is not completely updated. I have to go through and update the entire thing. So if you could please not follow those dates as of right now until I tell you to follow those dates, and please just follow the syllabus dates, and we'll go over those in a second. The book that we're going to be using is Administering Medication. It's the 8th edition, and it's Pharmacology for Healthcare Professionals. All of our assignments will come from this. All of my exams come from this book. Everything comes from this book, so I would suggest that you buy it. Okay, so there's something to know about this. If you are choosing to buy your book online, then you may not get it in time. And there's huge things about my syllabus, and this will make sense in a second. So let's go over the syllabus a little bit. So one thing that is a big deal to me is that you know our AAMA CMA will only allow 2 absences. That means that your attendance is mandatory. That doesn't mean that you just skip 2 classes because you don't want to come. That means that you can only miss 2 classes. So if you can't plan sickness or illness, so if you get sick, then you know that you have that absence ready to go. But if you miss more than 2, then you need to make an appointment with Miss Tootie West to see if you can continue in the class, because usually you're just dropped from the class. So that's how that works. It is an accreditation rule. It is not just a rule that we made up. So it's supposed to help you learn how to be responsible for the field, that you can't just come and go when you want to. You have to be there on time. You have to be there and be responsible for what they ask you to be doing. So cell phones, I know that everybody has a cell phone. I have a cell phone, and it's super fun to have. But I would ask that you keep those on silent. so that we cannot interrupt the class. Every once in a while, a phone will go off, and I don't want you to be embarrassed. It just happens. But please don't text during class. It really disrupts me because all of a sudden I'm like, ooh, what are they talking about? So unless you want me to come grab your phone and finish your text messages for you, I would suggest that you keep it in your bag. Um, Laptops. I don't care if you use laptops. I think it's an amazing tool. But if you're using it to cruise Facebook or to chat with your buddies on iMessage, please don't do that. That kind of disrupts your ability to learn and probably your neighbor's ability to learn. And then talking in class. I want everybody to be friends. In fact, I make groups, which I will do next week. And I think it really helps everybody get to know one another. If you feel like you really need to chat with somebody, like maybe you found the one, then I would suggest taking that one outside, asking them on a date, and then coming back in class. Don't disrupt class with talking. And then tardiness. Okay, so I am the queen of being tardy. The queen. But it's really important that we're all on time for class. So I'll try if you try. I mean, I'll do it and you'll do it. Okay, so the biggest thing in my class is I do not accept late assignments, ever. We're in college. This is what we need to be doing. So do not ask me if you can turn in an assignment late because the answer will always, always be no. So please do not ask me if you can turn in assignments late. The same goes for exams. I do not do late exams. Under any circumstance, I do not do late exams. This is really important for you to understand because many times I've had students come say, well, I can't take the exam. I'm sorry, that's just how it is. And everything in the syllabus is laid out for you. So if you say, well, my internet crashed, or I lost it, or I left it in my backpack at home, you have a syllabus in front of you. You understand what's required of you from this day forward, if you haven't already looked at it. From this day forward, I expect you to understand when your assignments are due. If you do not turn them in, then you just don't turn them in. If you don't take an exam, you don't take an exam. I do not do extra credit either. So please do not expect extra credit at the end of the semester because it won't be there. If you're trying your hardest, then you're going to get a great grade in this class, I promise you. Pharmacology is very interesting. It can be difficult at times, but if you study and if you listen to what I tell you and when you need to be studying, then you're going to do great. We will have a couple guest lecturers come to our class. Dr. Jake Luke, he is a pharmacist and he is an amazingly smart man, and he'll be teaching us about Chapter 6 and Chapter 7, which is the vitamins, minerals, and electrolytes or something like that chapter, and also the antibiotic chapter. And then Dr. Aaron Cooper will be coming in as well. He's another pharmacist. They're both from the PICU, so they'll be teaching you. And I think it's a really great touch that pharmacists can come in and teach you and help you learn from a pharmacist's point of view how drugs work. They're both very organized, and I think that you really enjoy it. All of your assignments are going to come from the book, like I said before. Your books have probably been used before if you bought them used. If they're already filled in, please don't copy them if you can help it. It would really help you to fill them out to understand, especially the math chapter. That's where it really comes in. So if it's already written in the book, please use a notepad and use the notepad to write down your answers instead. Something that I've had on a review was that the assignments, we correct the assignments in class and I have you switch with another student to correct each other's. And I had someone say that they didn't feel like it could be trusted because another student was correcting it. Well, we do go to LDS Business College. We do work off the trust and the trust system. And the honesty principle. So I would really expect you all to be honest in correcting these papers and also in taking your exams. If at any point you feel like someone's cheating or not grading you properly, then I would appreciate you to come talk to me privately. I don't want you to say it in front of class because that's embarrassing. So please come talk to me after class. Another thing is if you feel like you need help or you're falling behind, please come talk to me. I will help you the best that I can. They have tutors available to you, which Sister West can tell you a little bit more about, on the 9th floor. If you have anything else that you need, please come talk to me. I'm always willing to help you out. please email me. If I'm not getting back to you through email, then you can text me, and I will give you that number on Wednesday. But please don't text me at 3 in the morning. Just use it because when you need it, because I'm not responding to something. Okay, so let's go over the syllabus a little bit. Important dates. So what I want you to do at this very moment is I want you to take out a piece of paper or your calendar or whatever it is that you need and write down the following dates. So all of my exams are on 4 chapters each. These chapters are big chapters, so I really do expect you to study and read. So on the syllabus where it says prepare and to please read chapter 1 or chapter 2 or whatever it may be, please read those chapters. So today we're going over chapter 1 and 2. Obviously you couldn't have read those prior to today, but I do expect you to start reading ahead of class so then we can really talk about it in class. Let's see. So let's talk about the exam dates first. So on October 6th will be your very first exam, and it's on chapters 1 through 4. So that's October 6th, exam 1, chapters 1 through 4. Okay, your next exam is on October 27th. This is exam 2, and it is chapters 5 through 8. And then you have exam 3 on November 24th, and that's chapters 9 through 12. And the reason why that one is a full month away is because those chapters are kind of big and a lot more in depth, and I feel like you need a little bit more time to study those. And those will also be times when a pharmacist will come see us. Then on the final exam will be on December 15th. That will include the math exam. So you will not have any math on any exam except on the final exam. So one more time. You will not have any math on any exam except the final exam. So please remember that. Please remember that. Those are the really, really important dates. So the other things that you're going to need to know is in the due section, in the proof section, I have due dates. So I have not due dates, but what's due that day. So it's not due the next week. It's due that day that I have it listed on. So like I mentioned before, don't pay attention to Brain Honey. Please pay attention to your syllabus because that's going to be giving you the days. When I assign you to groups, these are the groups I expect you to work with, to study with, and you will be giving group presentations as part of this class. So when you are studying and you're struggling with an assignment, I expect you to call your group member and try and go over it with them before you come to me, because I feel like as a group you can really teach one another, which is part of our learning cycle. So this is basically the syllabus. So please pay attention to it. Write down those important dates. Please do not forget. And I will help you as much as I can. The reason why I'm so strict about this is because I've had multiple students come up to me and ask again for late assignments or late exams. But the one thing that I was shocked about is they said, I didn't know an exam was coming up. You didn't tell us. I'm telling you now, it's on the syllabus. It's in red. So you shouldn't miss it. You really shouldn't miss it, especially if you're writing it down like you just did in your planner. Okay, so the last thing I want to talk about is the spiritual challenge. So I would like you guys to do a spiritual challenge. I will follow up with you next week on, not follow up, I will tell you exactly what it is next week when I see you, but there will be a spiritual challenge involved. I really feel lucky that we come to LDS Business College so then we get to talk about Christ and about our Heavenly Father and how incredible His creations are, especially in the health field. I mean, there's a lot of blessings that we have in the health field. So I would really like to talk about some of those things in class with you as we go through all these amazing body systems that we have and the drugs that we've been able to make to help cure problems and help treat problems. So let's start with chapter 1. So if you can take out your books and open it to page 2. Um, we will start. How's that sound? Just so you know, this class probably isn't going to be very long today because I'm going over a video. But usually we will take the full 2 hours. And as you'll notice, on your syllabus, there will be exams that you take, and right after we have lecture, because there's just not enough time to let you take an exam and just go home, which would be super awesome, but sometimes that doesn't always work. Okay, so we are going to start with chapter 1, which is called Orientation to Medication. So exciting, I know. So, let me get everything fixed. Sorry, I hope you're not getting seasick. So, pharmacology is the study of drugs. It's a really amazing thing to understand that there are drugs that can do all sorts of things. Even some drugs are created, they're not used for what they originally made for, which we're going to be talking about. So I'm kind of excited about those things. Pharmacodynamics is how our body responds to these drugs. So everybody's body responds differently to drugs. It's interesting because you see, I take Benadryl and I am completely knocked out for 18 hours. You have someone who takes Benadryl and it does nothing for them. Or you have a person who takes Benadryl and they are hyper as all get out. So everybody metabolizes drugs differently. And it's just how our body makeup. So usually, and some people are allergic to drugs, some people are not allergic to certain things, so it just kind of depends on that person. So we have pharmacokinetics, which is the absorption, distribution, metabolism, and excretion of drugs, but we are going to go over this a little bit more in chapter 2. So pharmacodynamics are how they go through our entire system from the time we put it in our mouth or into our veins, all the way through the time that they are excreted. So that's a pretty neat chapter. So everybody has either had, is taking, or is going to take anatomy and physiology. So anatomy is the structure of our body, and physiology is how our body works, which I think is really, really cool. I am a huge fan of those 2 classes. But I think that you will enjoy them if you haven't already had them, and if you're taking them now, take a deep breath. Sometimes they're hard, but you will love them. But as you'll see in these chapters, we talk a ton about the anatomy and the physiology, and also the pathophysiology, so the disease processes of the body, and how drugs affect the anatomy and physiology and pathophysiology of the body. And then you also have psychology. So there are certain drugs that can affect the psychology of a patient. We don't get to go over the psych chapter, but there are some really neat things in the psychology part of using drugs. So we'll talk a little bit about those effects. So a drug is a chemical substance that we put into our body. It can be from a plant. It can be synthetic. It can be from an animal. It can be any of these things. But it is something that we put into our body for diagnosis, treatment, or care or prevention of a body. They have a therapeutic effect, which is what it is originally used for. So when I take a Tylenol for a headache, the therapeutic effect is to help my pain. The side effects of drugs are the adverse effects that this drug may have, or something that it wasn't originally made for. There's a really good example of this. So everyone has heard of the drug Viagra. Well, the name of it, the generic name of that drug is sildenafil. Sildenafil was originally made for pulmonary hypertension because it vasodilates, which means makes the vessels bigger in lungs. Well, they noticed a side effect of the drug was to help with erectile dysfunction. So they started using and marketing sildenafil as Viagra as a way to help men with erectile dysfunction. So that is a perfect way to describe what a side effect is. But you also have adverse reactions, which would be if I take a narcotic like morphine or Dilaudid or fentanyl. Any of these types of drugs would make it so I was really sleepy, or I wasn't breathing deep enough, or if taken in a huge dose, in a dangerous dose, then it would stop my breathing completely. So this would be an adverse reaction, or maybe an allergic reaction as well. So there are different parts of a drug that you need to be careful with. Something to know about drugs is, I'm going to use ibuprofen for a second. So they all come in 200 milligram tablets. If I take 200 milligrams, that's going to have a therapeutic effect. If I take 400 milligrams, that's going to have a therapeutic effect. If I take 600 milligrams, that's going to have a therapeutic effect. And if I take 800 milligrams, that's going to have a therapeutic effect. Now, more is not always better. So if I take 1,000 milligrams, the therapeutic effect stops here at 800 milligrams. That's why there are rules about what to take. So it's not like, okay, well, I'm going to take 1,000 because my head hurts so bad, I want to take 1,000. It goes from therapeutic effect to now it's toxic. So when someone or doctor tells you, please don't take more than 800 milligrams of ibuprofen every 6 hours, it's because the therapeutic effect isn't helping anymore. You're not getting the amount, you're not going to get any more pain help because it can't possibly give you more pain help. It's just not helping you. It's just getting more toxic in your body, and it can do bad things to your body. So those are things to think about when it comes to therapeutic effect. So drug sources, what I would do with this is I would really study this area because this is huge on your exam. It's just like a few short paragraphs, but this comes a lot on your exam, so please study this area. But like I mentioned before, you have four drug sources. You have plants, animals, minerals, and chemicals. And chemicals are known as synthetic drugs. So what I would know about this area would be what comes from a plant, what would come from an animal, that type of thing. But to give you a full example, a few examples would be like from a plant would be digitalis, digoxin. That is a drug that we use in heart patients. Or if we take animals, think about diabetes mellitus, we would use insulin. So that can come from animals. So those types of things. What about certain types of antibiotics? Those can come from the lab. So they could be synthetic. So those are things to think about when studying for this exam. So drug uses. This is what we started talking about a little bit before when talking about what drugs are. So we have contraceptives. Most people think about contraceptives as a way to prevent pregnancy, but they are also to help health maintenance. So contraceptives are not only used for helping a patient not get pregnant. It can be helped in regulating our menstrual cycle. It can help with acne. It has a lot more reasons than just preventing pregnancy. Then you have disease prevention. So if you can think of one of those, what do you think would be a disease prevention drug? Think about it. That would be a vaccine. A vaccine can help a lot with disease prevention. Now there's so much talk about how vaccines can really, really hurt someone, like maybe they'll give them autism or something like that. There have been so many studies, but not having a vaccine can really be harmful to someone. And I have a whole soapbox about this that I'm not going to get into right now. But vaccines are a way to prevent disease. Then you have health maintenance drugs like vitamins that can help maintain your health, like the one a day, women's one a day or men's one a day. You see Centrum, you see all these different types of vitamins, but those do help maintain health. And we will talk about that more in chapter 6. Then you have treating a disease. So treating a disease does not mean curing a disease. What it means is it's helping to treat the symptoms of the disease. So like if you have a fever, Tylenol would help break that fever, that symptom of whatever you have. Like I mentioned before, ibuprofen for a headache or a migraine maybe. So those would be medications that would help with the treating of a disease. Then we do have drugs that do cure diseases. What are antibiotics? Antibiotics do cure disease, which I think is so awesome. So you have that as well. And then you have diagnostic drugs. Diagnostic drugs are pretty neat. So I don't know if any of you have ever had an x-ray where they had to put in contrast. That would be a diagnostic drug. Or a barium enema. That's also a diagnostic drug. Or something that I think is really neat is a radioactive drug that they put in, and it's like a tracer. So when they look at your gallbladder or something like that, they're tracing this drug and watching it until it gets to your gallbladder. So there are a lot of different diagnostic drugs which help you find the problem that, help the doctors find the problem that they're looking for. And then you have palliative drugs. So these are not to cure disease, but they're to help to improve the quality of life of a patient. So a lot of these drugs you see in patients who are passing away or who have less than 6 months to live. So they'll have pain medications or medications to help them breathe better or anything like that. So this would be what palliative drugs are. So there are standards of drugs. And what this means is if I have a drug that was made in California and it was made by the standards of California, and then I had a drug made in Utah and it was made by the standards that Utah set, but it's the exact same drug, how would that affect the way that the drug's given? So let's say that I've been taking a drug my entire life here in Utah, and then I walk myself over to California. Be a long walk. But I'm in California now, and I am taking the drug there. What if it affects me different because the standards were different for those drugs? So drugs are standardized across the US of how they need to be made. So you cannot have drugs that are made one way in one state, whereas in another state they're made a different way. They need to be standardized. So then they are safe for everyone, no matter where they get it. Something that I did not know until recently is that hospitals, if one hospital runs out of a drug, it has to buy it from another hospital. So I think that's a pretty neat thing, knowing that the standards are the same so that all hospitals are getting a drug that has met certain standards. And if you look in your book, the standards have been developed from the United States Pharmacopoeia National Formulary. Say that 5 times fast. Okay, so drug names. You have a chemical name, a generic name, and a brand name. So a chemical name, if you look at your definition, I'm sorry, it's been a long day. If you look at your chemical name, it describes the chemical composition and molecular structure of the drug. So they use the example of acetylsalic acid. So it's an example of a chemical name. So if you've taken chemistry, it's how the chemistry works. So exactly like it says, it's the chemistry of the drug, and that's the name that they give it. Oftentimes, the chemical name and the generic name are the same. Sometimes they're not, but sometimes they are. So the generic name is the name that is the official non-proprietary name assigned by the manufacturer with the approval of the United States adopted names. So if you think about Tylenol, the name for it is acetaminophen. That is the generic name. So you can see acetaminophen sold as Tylenol or as MAPAP or as other drugs that are not Tylenol. We usually call it Tylenol, but the name is acetaminophen. Brand names are what are marketed by a company, and they can only be sold by that company. So Tylenol, that company can only use the name Tylenol. So a lot of people ask, well, what's the difference between the drug then? There's no difference. So to tell you a funny story about this, Motrin is ibuprofen. So Motrin is the brand name. The generic name is ibuprofen. So Motrin comes in little orange pills. My dad swears that Motrin makes his headaches go away, but that ibuprofen doesn't. If you look at the bottle of Motrin, it says ibuprofen on the bottle. So my mom went to Costco and bought a giant bottle of ibuprofen because it's a lot cheaper than buying Motrin. And they have the same orange pills, however, it doesn't say Motrin on the pill. So you should never do this, by the way. She mixed the Motrin with the ibuprofen, and my dad couldn't tell the difference. So it's just kind of funny. It is mentioned that some marketed drugs can have slight differences in their therapeutic effect. However, I don't think that's very common. Mostly it's just a marketing thing. So I usually go for the super cheap brands. Instead of Bayer aspirin, I just buy aspirin. So things like that. And a lot of pharmacies will actually only give you the generic name, the generic brand. So if your doctor writes for 800 milligrams of ibuprofen or Motrin, the pharmacy will actually give you ibuprofen instead of Motrin. And most insurance companies will only pay for the generic brand because it's so much cheaper and it does the exact same thing. Pharmacies can only give you, I don't know if only, but they can usually only give you the brand name if the doctor has specifically asked for the generic name not to be given, only the brand name. Okay, so you have a lot of drug references. So I have not asked you to buy the PDR because it's a huge book and a lot of pharmacists don't even use it anymore. They use different books to help. And also there's a lot of computerized places to help look up drugs. So Up to Date is one, Micromedics is one. You can get them on your phone, but I think they're pretty pricey. But I would look into looking up drugs in reputable places. But the importance of looking at drug references would be knowing the names of the drug, the way that they can be administered, so whether it's IV or if it's oral or if it's buccal or if it's rectal. I mean, it's a good thing to know how these drugs can be administered, the safe doses, the correct way to administer it, the side effects of it, and precautions to watch with it. So drug references are extremely important when giving drugs. It's not, you don't just give drugs. You have to really understand what is safe to give and what is not safe to give. And then knowing what to do in case of an overdose. So please understand that drugs are not just given. I don't just give a drug blindly. I give a drug knowing full well that what I'm giving, I know the side effects of it, I know how much is safe to be given, I know how to administer it, and I know that the side effects of it, what I need to be watching for after I give that drug. So a perfect example of this would be, I had a liver transplant little girl come back from surgery, and I had to give her medication that would lower her blood pressure because her blood pressure was too high. So knowing the side effects of this drug, it can have serious effects in dropping her blood pressure too fast. So knowing that information, I knew I was to give it IV, that I was to give it over a certain amount of time, and that I had to watch her and monitor her blood pressure a little bit more often than I usually would. So I was able to stay in the room and watch these side effects and make sure that she was okay. Because some people, and also watching for allergic reactions, because you don't know how someone's going to react to a drug when it's the first time they've taken it. So there are a lot of different words that we use, like, which we're going to discuss a lot more in detail. So PO, IV, PRN, QID, BID, all those types of things, but we will learn that, so don't worry. Okay, so something that I would suggest for you is making your own drug cards. So if you look on the bottom of page 9, it shows you how to make your own drug cards. Whoa, that's crooked. Anyway, but it shows you the drug, the action, the uses, the doses. So I'm not going to be testing you on, okay, so what are all the actions of it? What are the drug interactions of it? I'm not going to be asking a lot of those things, and if I am, then I usually review for exams. So I will let you know what drugs will be more so specific, like here or there. I don't give study guides. I just kind of review what might be on the exam. So of course there are laws with every single drug, and there's a whole table full of drug acts that I would like you to look over because I feel like they're important. Like, it talks about the FDA, it talks about legislative acts, it talks about nutrition facts, it talks about all these types of things that I feel are important for you to see how drugs are regulated. Another thing that is super important to understand are the scheduling of drugs. So this is on page 12. So schedule 1 through 6. So these were made a really long time ago. However, they were made because for the way that we prescribe drugs. Schedule 1 drugs, they are a high potential for drug abuse. They really don't have any medicinal purposes. And so they're classified as Schedule 1 drugs. No one prescribes these drugs. If you look at it, you'll see drugs like marijuana, peyote, heroin, hashish, like all these types of drugs. And there's a lot of discussion about marijuana, which I'll talk about in just a second. And a lot of people have things to say about peyote. However, the reason why it's scheduled as a Schedule 1 drug is because it does have a really high potential to become abused. So that's why it's a Schedule 1. And then as it goes down, it's less likely to, and they have more uses. The schedules are also used for who can prescribe them. So we have a whole bunch of different types of people who can prescribe drugs now. We have obviously attending physicians and residents and fellows, and we have nurse practitioners and physician's assistants. And there are some drugs that physician's assistants and nurse practitioners cannot prescribe. They can only be written by an attending physician, someone who's gone through full 8 years of medical school and all their residency. And that's what it can be written for. And you can see that as we go down. And also there are some drugs that you can't say, hey, can you call in that prescription for me? Because they can't call it in for you. You have to go in to see the doctor for him to evaluate if you really need that drug. So an example of that would be like a steroid, an anabolic steroid, or morphine, or any opiates. You'd have to go in and see your doctor so then he could see that you really needed it. All doctors are given a code called their DEA number. So each doctor, if you ever look at a prescription that you receive, it will have a little number at the bottom, and that's his DEA number. That is how pharmacies track and how drug enforcement checks and tracks what doctors are writing for. So I'm sure you've seen on the news before that doctors have written a ton of prescriptions for things they shouldn't be writing prescriptions for, like, oh, that person wants oxycodone. Perfect. I'll just give them some oxycodone. That person would like some Lortab. Perfect. I'll just give it to him. So they start watching this trend, and it's not a good thing. Then you have patients who come in and they try and trick different pharmacies. So they're like, I'm going to go to this pharmacist and they're going to give me oxycodone. And then they go to another pharmacy and like, we're going to take this, see if they'll believe that I need this oxycodone. It doesn't work that way because there's a complete system that checks to make sure that it's like this person got 30 Ativan today at this time. So if the next day, if they went and tried to get 30 more from another pharmacy, they could check in there and it would say they got 30 yesterday and they can't have another refill until 30 days from now. So it's really awesome that they can do that. So there's a lot of different things that you can see within the scheduled drugs. So I told you I was going to come back to the marijuana. Marijuana is Schedule 1, but it's also a Schedule 6. The reason why it's a Schedule 6 is because if it is used appropriately, like for seizures, how some laws are being passed for seizures, then it doesn't have that high risk for addiction because it's being used as a drug for a medicinal purpose. Whereas if I'm just on the street smoking marijuana, then I have a lot to worry about because I might have a easier way to get addicted. I apologize. So being a member of the healthcare team, I cannot tell you how many people have gotten fired from using and abusing drugs in the healthcare field. How we chart drugs, how we get drugs out of different systems. I mean, we're fingerprinted. If we don't properly document our drugs, then we can be in sincere disciplinary action, even losing our licenses. So it is suggested that you really, really watch how you give drugs and that you give them appropriately. Also, not only, being selfish and thinking about myself and what could affect me, but you're responsible for someone's life. So when I give drugs, I always look at my patient 3 times before I administer that drug because I want to make sure that I have the right medication. They are completely trusting me to give them the right medication. So it would be a really good idea for you guys to understand the weight that giving medications can be. Even Tylenol or even ibuprofen, I mean, these things may seem like little things, but they can do severe damage if they're not given the right way.